Hello to this part from the online course on public health ethics. Now we're going to talk about the guiding ethical principles for public health. There are many, but I'm going to select some of them and then to give examples of how can they be used for moral reasoning and ethical analysis. There's the principle of utility, introduced to it in the last video when we talked about the school of utilitarianism or the consequentialism. So utility is acting so that to produce the greatest good for as many people as we can. The second principle is efficiency, which calls for minimizing the resources needed to produce a particular result or maximizing the results that can be produced from a particular set of resources. This is particularly important when we're talking about the resource allocation example that we'll discuss later. The principle of liberty, so that one should impose the least burden on personal self-determination that is necessary to achieve a legitimate goal. So this is important again in striking the balance between the public health measures that we need to take compared to the person's liberty. There is the principle of fairness, so that we're treating like cases alike. Reciprocity, individuals, including the professionals as well, accept the risk in executing their duties would engender reciprocal duties on the part of the community to them. So that, for example, public health workers working in a pandemic or an endemic, they're putting themselves at risk. One would say that, okay, this is their duty, yes, but it is expected the community would return a favor for them, if you like, in return to this putting themselves at such a risk. There's the issue of proportionality, so that the actions taken by the public health authorities need to be proportional to the need to achieve a legitimate goal. So, let's apply these principles to our case. Just to remind ourselves, we have a country, all the TB patients receive a free treatment. What happened is the tuberculosis officer in the region of that country noted that one of his patients, Mr. Contagious, did not receive his doses for the last couple of weeks. He persuaded him to take the doses on time. The patient refused, so the officer went to the Attorney General in that region, assuming that or claiming that Mr. Contagious is a danger to the public, and the Attorney General issued an order of arrest for the duration of the tuberculosis patient. Now, let's apply these principles and see an example of moral reasoning, and you will be asked to provide something in more details in your assignment. So, these are just examples of how to apply these different schools of thoughts and the principles to such cases. For example, if we apply the utilitarianism, one would argue that it could be ethical to jam Mr. Contagious, and this may keep more people protected. From an autonomy perspective, it does not seem to be moral to force someone to have his medication against his will. If we apply the principle of liberty, looking at this patient is not the least burden measure to achieve the public health goal. If we're talking about reciprocity, fine. If you want the patient to comply, in a party, this is his duty toward the community, and this is again something that we can argue for or against. However, the authorities should have or could have offered something in return to the patient. If we're talking about proportionality, one would argue that the action taken are not proportional to the need to achieve the goals of the public health